My name is Heun. I'm a consultant psychiatrist. I'm editor of Global Psychiatry Archives, and this is in our series Mental Health Disorder Explained. I'm talking about bulimia nervosa today, and in essence is characterized by recurrent episodes of binge eating with compensatory behavior, overvalued ideas of about what's an ideal body weight, and there can be a past history of anorexia nervosa in the third or fifth half of the people. Strangely enough, the body weight can be normal. Happens more often in women than men, 1 to 1.5%. Usually starts teens or early 20s. But it can also happen in later life. The etiology or the causes are similar to anorexia nervosa, with a history of obesity, family history of affective disorder or substance abuse, and dysregulation of eating, and very weird imagination of what normal and not normal eating should look like. And also some obsession with the body weight and body shape. Usually the prognosis is not too bad, not as bad as anorexia nervosa, but can be more problematic in people who have personality disorders or other mental health problems such as low self-esteem. In the diagnosis, there is the importance of preoccupation with eating, irresistible craving for food, binges. Binges means times of extreme overeating. Then, on the other hand, attempts to manage this by vomiting or self-induced vomiting, use of purgatives, periods of starvation, use of drugs, appetite suppressing medication, thyroxine and diuretics, and there is this dread or anxiety of fatness, and the thought about how low weight should be. Usually for the diagnosis, you can ask some questions, do you make yourself sick because you feel full? Do you worry you have lost control over how much you can eat? Have you lost control over your weight? Have you recently lost weight, such as a stone in 3 months? Do you believe yourself to be fat in contrast to other people in your environment? And how much time do you spend on thinking about food? So just binge eating on its own is more or less the same behavior, but less so with the counterproductive actions. So there's more eating a lot, being full, feeling disgusted, but there's no self-induced vomiting and all the other extreme measures which people with bulimia may take. With purging or whatever, you have problems which affect the electrolytes, can be problems with arrhythmias, heart failure, severe electrolyte disturbances, metabolic acidosis, and alkalosis, so in case of extreme vomiting. There can be esophageal erosions when you just vomit too much, and the acid from the stomach goes into the esophagus. You can have esophageal perforations, ulcers, pancreatitis, extreme constipation. There can be dental erosions from the vomiting, and you can have disturbance in the white blood cells. Usually you have the same assessment as anorexia nervosa. We come to that in another video. So there might be some differential diagnosis. A rare disease are these bulimias, which are related to sleep disorders, frontal lobe Tumors can have an effect in eating behavior, personality disorders, depression, obsessive compulsive disorder. You can have problems when you have medication. I talked about that. Antipsychotics and clozapine might affect weight. We have a video on weight gain in mental disorders, which you might be interested to have a look at. So there's lots of comorbidity in all these diseases. Anxiety and mood disorders are prevalent. Other behavioral disorders like self-harm can be problems if there are impulse disorders or borderline disorders in relevant. Okay, that's it for me. I hope you have a bit of an idea about what this is about, and we come to other mental health disorders in the next time. If you're interested, please subscribe to our channel. If you've liked it, oh God, yeah, that'd be great. Then give us a like and have a nice day. I wish you all the best, and I think that if we inform people and the community about mental health disorders, they can be more aware about that. One of the things I can say from research is that we looked at the fact what family members know about others' diseases, and there's something which is strange. People very often can detect that patients or their relatives have mental health problems, but it's extremely hard for family members and relatives to distinguish them. And this comes into the concept of mental health literacy, which is something there is lots of research. And we did some research, or we published some research in our journal, Global Psychiatry Archives. Okay, that's me done for today. Have a good day and all the best. Goodbye.